AndroPauseSpecialist.com, Section 1. Understanding Andropause. Erectile dysfunction and low testosterone. As you get older, it becomes more likely that you'll experience erectile dysfunction. In fact, about 30 million men have some form of it. Some statistics to know. Even at age 40, 5% of men can't achieve an erection rigid enough for penetration. About 15% of men have significant problems getting or maintaining erections. In men older than 35, the cause is usually physical, and for men younger than 35, it's generally a psychological issue, but either way, medical help can often solve the problem. These are the main causes for erectile dysfunction or impotence. Vascular. Arteries need to bring blood to the penis so that you can maintain an erection. So, any damage to the arteries can lead to this problem. If you have a history of coronary artery or heart disease, strokes, or peripheral vascular disease, this could affect the penile arteries. Even prior to these severe vessel diseases, you may have problems with erections. You should also know that smoking is a main contributor, as well as high blood pressure, especially if it's uncontrolled, heart disease, high cholesterol, and diabetes. Neurological. This system must be intact for an erection to occur. So, if a patient has multiple sclerosis or damage to peripheral nerves from diabetes, he may have a problem getting an erection. Hormonal. If you have low testosterone and thyroid hormones or high prolactin, this could be a cause of erection problems. Psychological. Sometimes this is an initial problem and sometimes a secondary problem. This means that a psychological issue may be the reason you are not achieving an erection, but the psychological issue could be a response to a physical problem. Losing confidence in getting an erection can change your attitude or interest in sex. At this point, achieving and maintaining an erection may be more difficult. Erectile dysfunction treatment options. Generally, a straightforward case of erectile dysfunction, for example, a 65-year-old diabetic who wants rapid treatment for sexual impotence, can be dealt with by a general urologist. That starts with the doctor taking a thorough history and doing a basic evaluation. This includes a physical exam focused on the problem with a measurement of penile sensation and a hormone check. Options should be explained at this point. Most often, that would include an oral medication with side effects explained and the doctor writing a prescription. Follow-up exams should be scheduled, and if there are unpleasant side effects from the oral medicine, other options can be considered. Oral medications. Oral medications include Viagra, Levitra, and Cialis. All three medications should be taken approximately 60 minutes prior to engaging in sexual activity. Viagra and Levitra are effective for approximately 4 hours. Cialis is effective for 36 hours. Viagra is less effective if it is taken within hours of having eaten fatty foods, so those types of food should be avoided when taking Viagra. Ideally, Viagra should be taken on an empty stomach. Please be aware that none of these drugs will affect desire in any way. They will merely make a penis respond more quickly and remain firmer when it is stimulated and aroused. The maximum dosage is 20 milligrams of Levitra or Cialis and 100 milligrams of Viagra. This should not be exceeded in any 24-hour period. Even if a lesser dosage is used, it should only be used once in a 24-hour period. Although all three of these medications work slightly differently, the basic functioning is the same. They block an enzyme that normally prevents erections from occurring. When a man is sexually aroused, nitric oxide is released, which causes a cascade of biochemical reactions. The blood vessels and tissues of the penis relax and dilate, allowing blood to rush in and an erection to occur. These oral medications block the enzyme PDE5, which reverses this cascade. Please note that all of these drugs are not advised for men who are currently using nitrates or have retinitis pigmentosus. Other men who may not take the available oral medications are those with a predisposition to potentially hazardous cardiovascular events. These conditions include unstable angina, congestive heart failure, taking multiple antihypertensive drugs, MI, heart attack, CVA, stroke, or life-threatening arrhythmia within the last 6 months, hypotension, decreased blood pressure. Patients on alpha blocks for high blood pressure or prostate problems should not take Levitra or Cialis. Any men who fall into the above categories should see an erectile dysfunction specialist, as there are very effective alternatives available for treating impotence. Other reasons you may want to consider seeing a specialist include if there has been a sudden onset of erectile dysfunction, you are under 50 years old, you have Peyronie's disease. Some men may choose to start the process with a specialist even if they do not fit these criteria, since a specialist is able to take the time to evaluate, understand, and get to know a patient. Also, a patient may want to fully understand the physical aspects of his problem, as well as the psychological issues and ramifications. Finally, the atmosphere in a specialist's office may be more personal and private. Other options. If a patient is unable to take one of the available oral medications, or if the medications are not working as desired, there are effective alternatives available for treating impotence. Oral medications work for 70% of men. For many of these men, it is truly a wonder drug, giving them excellent, predictable, and long-lasting erections. Oral medications have revolutionized the treatment of erectile dysfunction. They have brought the issue into the open and have given many men hope. However, for 30% of patients, the oral medications fail. For these men, the oral medication does not work well, does not work at all, or cannot be recommended from a medical point of view. These men are often more unhappy than before they sought treatment, since they are convinced that they are alone and that there is no help for them. This group, in particular, should see an erectile dysfunction specialist, as there are other excellent options for the treatment of their erectile dysfunction. Physicians who specialize in impotence are the most comfortable and confident at presenting, teaching, and performing alternate treatments. One of the options available for the treatment of erectile dysfunction is the self-injection of medication into the penis. This often sounds scary to the patient and not particularly appealing. However, in reality, the technique does not involve a traditional syringe and does not hurt. Often, once a patient understands the reality of his treatment, he is willing to consider this highly popular and effective treatment technique. The medication is delivered to the penis using a device that is similar to the ones used by diabetics. A disposable syringe is placed on the injector. The device is placed against the side of the penis and a button is pressed. A spring then pushes a very thin needle into the penis and, at the same time, pushes the medication into the penis. Men normally agree that the injection does not hurt. Most patients describe it as either painless or as if they have been flicked with a rubber band. The injection is extremely quick and uses a very fine needle, usually a 29 or 30 gauge. Additionally, since the side of the penis does not include many pain receptors, there is little sensation. The three most common medications used for injections are papaverine, phentolamine, and prostaglandin E1. All three act by relaxing the smooth muscles and causing the arteries to dilate. This activates the trapping mechanism. Prostaglandin E1 received FDA approval in 1996 for erectile dysfunction treatment. It is currently marketed and available in prescription plans under two brand names, Caverjet Impulse and Edix. The different medications have different characteristics. The papaverine and phentolamine come in a liquid, do not need to be refrigerated, and have the least discomfort associated with them. Prostaglandin E1 is a powder that is mixed with a fluid prior to use. This is due to the fact that it is stable as a powder at room temperature but not as a liquid. Prostaglandin E1 can cause some ache. Although it is not medically concerning, it can be uncomfortable. However, in most cases, the discomfort is short-lived. Discomfort is experienced by approximately 20% of patients and is most common in patients who have neurological erectile dysfunction, such as diabetes or post-radical prostatectomy. The two main potential complications from the injections are the development of scar tissue and the possibility of a prolonged erection. This risk is significantly minimized when you are seeing a physician who is very experienced with this treatment option and the appropriate dosing levels. Also, the risk of scarring is greatly reduced if the penis is compressed for 5 minutes after the injection and the site of the injection is varied. Penile injections were developed approximately 30 years ago and were the second method developed for the treatment of erectile dysfunction. The first treatment method was surgical and involved the insertion of a penile implant. Experience suggests that many men are successfully treated with injectable medication. Their erections are often much stronger and more reliable than those from the oral medications. In some ways, the injection is a more spontaneous solution for treating impotence, since it can be used right before a sexual encounter. With foreplay and the medication, the individual gets a good, strong erection. Additionally, and importantly, some studies suggest that men who use the injections on a regular basis have a high likelihood of seeing improvements in their spontaneous erections.